Most women aren't prepared for what happens after birth. They're told it's normal the leaking, the weakness, the disconnect. But what if it's not about something being wrong? It's just about something being missed. This is the conversation I wish more women had before pregnancy and the one every woman deserves to hear. Today, we're talking about how to support your body before, during, and after birth because your body is always communicating. The question is, have you been taught how to listen? Come join us. Women's Wellness Authority is a podcast for women who want to come home to themselves, physically, emotionally, and energetically, while exploring grounded, root level approaches to healing. In each episode, we explore the many layers of wellness through thoughtful conversations with experts, healers, and practitioners, helping you better understand what your body is communicating. This podcast is about empowerment, offering practical tools and wisdom to help you thrive in all areas of your life. Let's rewrite the rules of wellness together, step into your power, reclaim your health, and discover what it means to truly thrive from the inside out. Welcome back to Women's Wellness Authority. I'm your host, Diana Ruskowski, and today's conversation is one I believe every woman deserves access to before she ever reaches postpartum. Because so much of what women experience after having a baby, they're told is just part of the process. And while it may be common, it doesn't mean it's something we should ignore. I'm joined today by Rebba Kipp, doctor of physical therapy and owner of Tranquility Pelvic Health. She provides pelvic floor physical therapy and birth doula services, specializing in supporting women through pregnancy, postpartum, and chronic pain. Her work focuses on symptoms so many women are told to live with, things like urinary leakage, low back pain, constipation, and pain with sex or exercise. And Reba also holds her pregnancy and postpartum exercise specialist certification. And what I really appreciate about her approach is that it's not fear based, it's educational. She's passionate about making these conversations less taboo and helping women understand what's actually happening in their body so that they can feel more supported and more empowered. And in this conversation, we're talking about what's often missed in pregnancy care, why so many postpartum symptoms are normalized, and how to start reconnecting with your body in a more informed and supported way. So, welcome, Reba. Thank you so much for joining us today.
Thank you for having me.
So, before we get into prevention, I want to
Mhm.
start with what most women actually experience, because I think there's a lot of people that will recognize this in themselves. Can you share what the most common postpartum complaints are that you see?
I see a lot of back pain or hip pain or just changes, right? Like something doesn't feel right, or they're getting tired holding the baby at night, so their back starts to ache. Might start noticing urinary leakage when they start to return to walking, or we live in North Carolina, so when they start sneezing during this pollen season, that's a common one. Constipation, having difficulty relaxing their pelvic floor to have a bowel movement or returning to intercourse. It doesn't feel the same or it feels painful. Those are some really big ones. And then there's a lot because everyone's postpartum experience is different. So I think a lot of the things that I say to patients are validating more like that's common, but not normal, not something you have to
I
live
was
with.
just gonna say,
Yeah.
that's I think what my takeaway was from our conversation, like, in preparing for this, which is, like, this is not normal, it's common.
Yeah, exactly.
And what
Yeah.
women are normally told is that it's normal, you gave birth, you should feel like this, it'll get better over time, whatever, but it's common, not normal.
Yes, exactly. And that language really, like, can affect your perception of yourself. So I had a patient that noticed that she thought she was seeing, like, an organ when she was peeing or, like, wiping after she gave birth, and the midwife was like, "Oh, that's just normal." And so she never sought help until, like, years later, and her kids were in school, and I was like, "Oh, that's just common. You're not broken or anything." And she's like, "I thought I had done something wrong or, like, this was my whole life now." And I was like, "No, your body went through changes. Of course, like, your organs are gonna sit in different places initially. That's not something you have to live with." That language can really affect things and, like, our perception of what we're going through.
Yeah, because I think if you think it's normal, well, then I just kinda, like, have to suck it up and just kinda move on, right? And
Yeah.
live
Yeah.
with an organ coming out of your
Yeah.
body? If I don't know if
Yeah.
that's what actually was happening.
It feels that way. Yeah, but
Yeah.
that's not what was it. Yeah.
No, thank God for her. What are all of these common symptoms? Are they signals from the body trying to say that something is in fact wrong or just different? And how would you give advice to women to, like, notice these things?
I think a lot of these things are our body's way of readjusting, especially if we're talking about just the postpartum period.
Mhm.
Our body has 9 months ideally during pregnancy to adjust. So our ribs get wider, our diaphragm, our breathing muscle sits higher, our organs shift up, our pelvic floor has to adjust to the weight of this growing baby, the placenta, our uterus stretching. So when then you give birth, whether that's via cesarean or a vaginal delivery, your body needs time to like readjust. Or another common thing that I talk about is people are concerned about that diastasis recti, so that abdominal lengthening down the center that they might notice during pregnancy, like when they're getting up from the couch or anything, they'll see that little cone pop up here, and that's actually supposed to happen. So it's an abdominal lengthening of your six pack muscles, and that can go back together or that can get tight again. But again, it's not something that someone did wrong. Like your body was adjusting to make room for baby. So your abdominals have to stretch 110% to get to full term. That's a big deal. Yeah. So
Yeah.
that's gonna take time to go back.
I think that is profound. That was profound when I heard you say that to me in our call, is that your body takes 9 months to adjust to what's happening. And
Yeah.
I think often, and we'll talk about this, when the baby's out, you're kind of expecting to like that your body's gonna get back to normal within a couple weeks, a month, 2 months, 3 months, 4 months. And when it doesn't, it's frustrating, and I will say definitely thought something's wrong with my body, or I'll look and compare myself to other people, which is probably the worst thing you can do, right? And say like, "What well, they seem to, like, be fine. They bounced back, like, their bodies look great. Why am I
Yeah.
feeling an organ when I go to the bathroom? Or
Yes. Exactly.
why am I experiencing all these things?" What would you have to
Yeah.
say to that?
I think it's so easy to compare. I mean, that's why social media is like this good thing and bad thing. It has a double-edged sword, but everyone's healing is different. So, were those individuals exercising before they got pregnant? Were those individuals able to work out and keep their quality of life throughout their pregnancy? What does their support system look like now postpartum to allow them time to rest and get back to things that they've enjoyed? Are they breastfeeding? Did they formula feed? All those things can like play a part in your healing or like what's happened to your body. For me, I was exercising before I got pregnant, but then I had a really symptomatic pregnancy. So I was throwing up or nauseous. I had difficulty getting food down. My fatigue, therefore, was like really high. And thankfully, this was my first pregnancy. So I did not have to chase a toddler around while doing that. But I had a really hard time working. So I was really deconditioned by the time I reached postpartum. And so I took a lot longer to recover than I think even I was expecting. And so, like, being kinder with ourselves and being like, everyone's on their own journey and we don't have the full full picture.
Yeah, but you have the knowledge and the education, right? That you have to listen to your body, and as a pelvic floor specialist, knowing, some of the signs of things that are happening within the body that you can use to support. So, I'd actually love to talk about education. I always love learning. I will say, had absolutely no idea. I knew what a pelvic floor specialist was, had no idea that I could go in to see somebody when I was pregnant. Can we talk about that a little bit? Like, why do you think there's such a gap in education around this? And especially during pregnancy, where if you actually go, it can be preventative care.
I think it goes, like, way before we even think about getting pregnant. I think the disconnect starts, I think, in adolescence. So, like, I would really wish that in our sex education classes, we talked about the pelvic floor and what are some common, like, signs and symptoms that things are not going well. Most people don't even know that they have a pelvic floor or that that's what's contributing to some of their symptoms until they have a life event like pregnancy. Then we start talking about it.
I mean, I was pregnant twice and I had no concept of how large my pelvic floor actually was until I had a guest on and they showed a structure and turned it sideways. I was like,
Holy crap. Okay.
There's a lot of muscles down there. Yes.
Yeah.
Yeah. And like, what are their functions? So it's like, I think it goes back way before we're even at the pregnancy stage. Like, what does the pelvic floor do? It's supporting our organs, it's helping us with sexual function, it's an extension of the core. So, helping stabilize our trunk, it's helping us control whether when we're peeing, when we're pooping, when we're passing gas. It's controlling all those things. And it's reflexive. So like we're not having to think about it most of the time until we have an interruption to the system, like pregnancy. Or like our uterus sits actually a little bit lower during a menstrual cycle. So sometimes people will be like, "Oh, I feel like heavier during a menstrual
Hmm.
cycle." And you're like, "Yeah, that makes sense. Like your
Interesting.
body was doing what it was supposed to do." And there is like ways that we can improve those symptoms if that's bothersome to you. So I think just even knowing that it exists and what the norms are then allows you to be like, "Oh, this feels different to me," or "This is changing. I don't have to live with that."
And I would like maybe wrongly assume if I go to my
Yeah.
gynecologist, they're educated in that way to inform me about it, right? But
Yeah.
that's not the case.
No, I feel like it's getting more and more common because everyone has their own different cultural background. So when you go into the OB, I think they're kind of waiting for you to be like, "Is that bothersome to you?" If that's bothersome, then I will mention it. And those appointments now I realize are very short during pregnancy. We have to be our own advocates in this space until it becomes, I think, more accessible. We have to be like, "Hey, I don't like that I'm now having this urgency to pee whenever I enter my house. I don't like that my back aches by the end of the day. Like, what can we do about that? Can I go see a pelvic floor physical therapist or occupational therapist?" Occupational therapists and physical therapists are both trained when they choose to be a pelvic floor therapist.
So an OT, but if you want to specialize in the pelvic floor, you would go to a pelvic floor specialist.
Yes, yeah, and they can be
Yeah,
an OT or a PT.
gotcha.
Yeah, I gotta get
Okay.
better about saying that.
What are women not told during pregnancy? That if you could get access to every single woman that's pregnant and be like a fly on the wall in those OB appointments, what would you want them to know?
That they just don't have to live with a lot of these changes. I think that's the biggest thing, and I think pain is one of the largest ones. So many people will be like, "Well, my body's changing, my body hasn't gone through this before if they're a first-time mom, so I must just have to live with it." And it's like, "Oh, no. No, 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 there's actually a really great preventative strategies that we can do. We can help your ribs move better throughout the duration of your pregnancy. We can help strengthen your core as it's stretching to make sure that we have that support. Your hips, right? Like our muscles are being used differently as baby grows. And so, how can we strengthen those muscles? How can we teach you how to lift and bend down with this change in weight in the front? All those things can make your pregnancy smoother and then, therefore, your postpartum experience a lot smoother.
God, I wish I would have known you. I had so much physical pain because I commuted and I saw a chiropractor and it maintained it to a certain degree, but I was so physically uncomfortable a majority of the time. And now I know it was weakness in my pelvic floor because it was lower back pain. And I just assumed, like, what can you do? There's nothing you could do about it. Like, the baby's growing, it's just sitting on a nerve. Like, I just kind of have to, like, just deal with it. Then you don't sleep, and then it's just this snowball effect, and you don't have to your point. So,
And, like, to your point, like, chiropractic care can be really helpful. So it's like I want in an ideal world, everyone would have this really great set of clinicians. They'd have their OB or midwife, they'd have their pelvic floor therapist, they'd have their chiropractor, they'd have a mental health therapist to, like, guide them through these changes.
mhm.
And it doesn't mean you have to see them, like, every week, but, like, it does mean that I think people should be able to draw upon them as they need them so that this process isn't quite as overwhelming.
I love your message of advocacy. So, what is a normal, typical OB conversation like today and versus what is needed? So maybe just to help coach, the women who are listening to be advocates, because I think it is even sometimes hard to know what's not common. And then what if your doctor just dismisses it and says, it is what it is. So,
Thankfully, our listeners are located in the state of North Carolina. You don't need a referral to come to a pellet floor therapist. Like we have direct access. So that's really nice. Like you can just call me up or call a therapist up and be like, "I would like to see you."
so that varies state to state, does
That
it?
can vary state to state. Yeah.
And
I
how
think
would you
most
find
states,
out if what the rules
yeah.
are? Just Google it?
Yeah, that or call and like ask. So like when individuals call me, they're like, "Oh, do I need a referral?" I'll be like, "No, like we can just schedule the appointment." The only time it gets kind of tricky is like during pregnancy, making sure that I can do an internal examination because there are certain pregnancy conditions that it wouldn't be appropriate.
Mhm.
generally
Gotcha.
if their doctor has told them to be on pelvic rest, meaning no intercourse, no inserting anything into the vagina, then we wouldn't do that. There's still a ton we can do though outside of that. And you had asked what like a typical OB conversation is. So during pregnancy, you'll go in, they'll take your blood pressure, they're looking to see, how your body's adjusting cardiovascular wise. And then they're also looking at the like growth of baby. They're asking how you're handling things. So because nausea was a big one, they were checking in on how often I was able to eat and drink, how hydrated I was. They were looking at if baby was getting distressed. So I got really dehydrated one time and they're like, baby doesn't really love that. So I had to go in for IV fluids and she was super happy afterwards. So like they're checking into like, how is your body responding on a very physiological level. And then when you mention pain or you mention leakage, then I feel like they're more apt to be like, go see this person, ideally, in an ideal world. And if not, then you can just call us up directly. And then in those postpartum visits, they're checking on your mental health status. So, like, are you having signs of postpartum depression or anxiety? How is feeding going? How is sleep going? How are you coping? They're checking on that. And then after those appointments, if everything's okay, if your blood pressure has returned to normal, if you're checking all these boxes, then they'll clear you for exercise or returning to intercourse. But they're not looking at how well does your pelvic floor contract? How well does your pelvic floor relax? Those things are what the therapists are specialized in treating.
And also, those should be a box on the list of things that get checked, right? Because just because you got cleared doesn't necessarily mean physically you are actually ready, but from an OB standpoint, what are they looking at?
They're looking at, like, if you had any perineal tearing, did that heal? Did your uterus shrink back down to size, or is it going that way? Did the bleeding stop, or is it trending to stop? If you had a cesarean, what does that scar look like? Is that healing well? They're looking for signs of infection. I had preeclampsia, so that's a hypertension disorder. So they were also monitoring, like, did my blood pressure go back down to normal? Are there certain medications that I need to regulate that? That is what their job is.
Mhm.
That's when we need those other clinicians to come on board. I would
Yeah,
love for it to be standard practice to be like, okay, now go to the therapist and see what that's looking like. How is your body adjusting?
that would be a dream, right?
Yes, from a muscle perspective, exactly. Or if you're like not just testing on a box mental health wise, like, oh, like you qualify for postpartum depression, but like everyone should get the opportunity to talk to a mental health therapist on the
Mhm.
transition to motherhood. So it's like that's when I feel like as long as you're cleared OB wise, that's awesome. But then it's like there needs to be like the step two. And then you need the other clinicians to come on board.
Yeah, because I just
Yeah.
kind of felt like I was scurried down the line,
Yeah.
and I
Yep.
wasn't also super in tune with my body, if I'm gonna be
Yeah.
honest. I wasn't listening to my body was giving me lots of signals, and I also lied. I lied on those postpartum questionnaires because I didn't even know how I felt. I didn't wanna be bothered, but I should've, like, spoke up more because I would've gotten the support I really needed, but I just was like, are they gonna even do anything about this? Because I feel like I'm here for my 10-minute quick, like, "Everything looks good, you're good to go, see you in 6 months."
I think a lot of it is also like we're not getting the best sleep at that stage either. And
Yeah, that's for
sleep
sure.
quality is definitely one of the biggest indicators or risk factors towards injury and mental health. So it's like sleep plays a huge role in things. And then just not knowing those norms. So it's like I would love to see people during pregnancy or before that and being like, hey, this is really common but not normal. And like reiterating what we're talking about at the top of the session so that people don't blame themselves. I feel like that's a big thing. Or we as women, I feel like there's this trend to be like, well, it's not bad enough, or we
Mhm.
have to like
Yep.
earn help in some way. And
Or wait till it gets so bad that you're so desperate, like, you need to see someone that day or the next day because you can't, like,
yes, if it's enough to bother you or have, or even just be a concern to you, then like that's worth care. And
don't wait till it gets to a point of desperation.
exactly, exactly, because it's so much easier to correct or fine-tune some things at the beginning
Yeah.
than waiting until it gets so bad, and you're
Yeah.
not helpless at that point. We can definitely help you and correct so many of these things, like, it's never too late, but it's so
Yeah,
sad to
that's
see.
actually a
Yeah.
great question. Let's talk about preventative care in general,
Yeah. Yeah,
but
yeah.
it is never too late, right?
No.
Like,
No. Yeah. Never too late,
never
and
too
then
early to come in and
no.
never too late to come in.
Exactly, exactly. Never too early, never too late. And sometimes we just don't know what we don't know. And
Mhm.
so a good therapist is going to be like asking you certain questions or helping prepare you. Like, hey, some women may experience leakage when they get towards the end of their pregnancy, when baby gets a little bit heavier and our pelvic floor might be tired because we're still working and like we're on our feet all day. And I think that's also like a good reminder. Our bodies might just be telling us something. Again, we didn't do anything wrong necessarily. Our bodies might just be like, "I need rest." And that's what a
Mhm.
lot of those symptoms of pelvic floor dysfunction can often be telling us.
So, what can women start during pregnancy? So, come in and see you, or there are things they can do at home? Or all of the
All of the
above?
above, all of the above, and I like a hybrid approach, right? So I want people to be able to do these things at home and help themselves feel better, but I also want to be able to help guide them in that process. So especially when they get to a point where like let's say they're not having pain. Let's say they're not having symptoms. Well, let's continue to strengthen the body and move well so that we can prevent a lot of things down the line. Some of the big things are our ribs. So our ribs tend to flare out in front, but our ribs are actually like a 360. So we need the side of our ribs and the back of our ribs to move well to help with that adjustment, to help us breathe, but also our diaphragm and our pelvic floor work together. So if we can breathe better and get this to continue to move, our pelvic floor can continue to move well. And then the other one is teaching people how to hinge, like how to lean forward or bend down to get something with appropriate form.
That's not gonna put, like, stress on the body?
No, well, there's ways to do it correctly and like to strengthen our body and to use our body well when we're pregnant and postpartum, which can prevent a lot of like those two things alone and learning that their pelvic floor exists and, like, tuning into that, I guess those 3 things are
Mhm.
incredibly helpful.
And do you have different approaches based on I know, like, in the pregnancy,
Yeah.
unless it's as you're getting towards the end and you know you're gonna have a scheduled C-section, are there different preventative approaches? Or do you have, like I know you don't have a one size fits all for a woman because everybody's body is different, but just curious about that.
I don't know if it's necessarily different approaches, but just meeting people where they're at, right? Like, if they are a woman like me who have been super symptomatic and nauseous and, like, throwing up and tired and having a very difficult or challenging pregnancy, that progression is gonna look different, right? Like, I did end up deconditioned, but I didn't end up in a lot of pain. So there are ways to like move our body without overdoing it in that particular case versus someone who's having a really great pregnancy and would like to continue to move and strengthen their body. They're going to have a different program set up. And even cesareans and vaginal deliveries when we're planning for either. I mean, 30% of women will have a cesarean, right? Like 30% of deliveries are cesarean. And so it's very common. And I would say a lot of the postpartum recovery is similar. It's just someone might be having pain at the perineum versus having pain at an incision higher up.
Okay. When you say well, you referred to this a couple times for you where you were deconditioned, what does that mean? What do you mean by that?
It means I lost a lot of muscle mass and cardiovascular wise, I was having a hard time. So walking a block was really hard for me versus prior to pregnancy, I could, go hiking and not feel overly exerted.
Mhm.
So, deconditioning is something that can happen to everyone because pregnancy causes these changes and then you go through birth. And so you have to take those like moments for recovery. But the severity of that is really going to depend on like your exercise and activity level prior to conception, during pregnancy, and then that support system postpartum.
You've mentioned a couple times the diaphragm and the pelvic floor work together. And, like, everything I've learned in all these working with all these specialists and talking to them is that all the systems in the body work together. Can you explain that a little bit more, the diaphragm and breath and how they all work together?
Absolutely. Yeah. So your diaphragm is your big breathing muscle that sits below your ribs. And then your pelvic floor is that group of muscle that sits between our hips. And so it's almost like the top of the core and the bottom of the core, if you will. And so as you breathe in, that diaphragm and your lungs fill with air, that pressure has to go somewhere. And so your pelvic floor kind of lengthens a little bit. And then as you exhale, that diaphragm and your lungs push all that air out and your pelvic floor can go up a little bit. And so it moves up and down like that. Now you can tighten your pelvic floor and relax your pelvic floor regardless of your breath, but sometimes it's helpful,
Which is like
especially
what,
when we're
Kegels?
Yeah, contracting your pelvic floor is considered a Kegel or pelvic floor contraction. And oftentimes I have to teach people how to relax their pelvic floor voluntarily because I had said at the top of the session, like your pelvic floor is meant to be reflexive. But oftentimes when there's now this weight of baby, our body might need a little bit of help turning into that area.
What do you mean by reflexive?
It's going to work without you thinking about it. Just like
Okay.
how like your heart is, is moving and we're not having to tell it to beat at a certain time. Our pelvic
Mhm.
floor is going to contract when we bend down a little bit, or it's going to relax when we're on the toilet and we're not having to think about it to urinate or to have a bowel movement.
Gotcha.
But we want to be able to have that voluntary control. So if we're having difficulty with those things, that we can allow our pelvic floor to relax. We can contract our pelvic floor if we need to. And our diaphragm is a nice feedback for that.
I have a really stupid question. I'm going to ask it anyways. I always thought your core muscles were on just on the outside, but you said core is
Yeah.
here and core is here. So that's
Yeah,
my
they're
first
both an
question.
extension. Yeah, so your core is like this whole canister. So it goes from front to back, top to bottom. But we just think of our six-pack muscles, but there's
Yeah.
actually our back muscles. We have our abs go from our front to our back in different
Interesting.
directions, depending on which muscles we're talking about. We have our back muscles, we have our diaphragm, we have our pelvic floor. All of that is considered our core or stability. And so we have to work it all together.
Okay. That makes a lot more sense because when you have lower back pain, they say strengthen your core. I always just thought it meant strengthen the front so that you have more stability, but it's okay. Well,
It's
there
the
you go.
whole thing. It's the
It's the
whole
whole
thing.
thing.
Yes.
Okay.
Yes.
And then my other question is
Yeah.
when you have your pelvic floor and your diaphragm, and then you
Mhm.
obviously have all your organs in between, but then add baby, is baby just restricting the ability to flex because of the amount of space it's taking up?
Yeah, we have, like, less movement. So,
Mm.
ironically, our diaphragm actually, gets muscle mass during pregnancy. It works harder, it gets stronger.
Okay.
It just can't move as much because of baby and the organ. So, it
Okay.
does get stronger, which is one of, like, the few muscles to have that opportunity just on an what pregnancy is supposed to do. But the pelvic floor has to accommodate the weight now of baby and the placenta.
Mm.
And oftentimes that's where we have a little bit of that disconnect because then our body can end up working like really, really hard and stay really, really tight. And then that's when people are like, oh, I'm having some back pain, or I'm having difficulty emptying my bladder, or I'm having difficulty completing a bowel movement. It's like, oh, because your pelvic floor is just hanging on really tight all day. It doesn't know how to accommodate that new load, and we can teach it how to do that better.
And what does stress do to all this?
Oh my gosh, our nervous system is connected to everything, right?
Yeah.
When we're stressed, we don't sleep as well, therefore we can't recover as well. When we're stressed, we tend to make our shoulders earrings and hold it up here and take shallow breaths, and therefore we don't get that nice movement. I also had a urologist tell me that the bladder is the most stupid organ of the body, and I loved that because he was like, "It's so easily trained, good or bad. You can train it to go, like, frequently, or you can train it to go at an
Really?
appropriate time." Yeah, but it, like, is affected by how much you like, what water you're having and, like, or if you're having caffeine, and everyone's variant like, everyone's different on how much that's bothersome to them, but, like, the bladder's so easily affected, and so it's affected by stress. So, when we're more stressed, we're more apt to have irritation at the bladder. So, you might go to the bathroom before you leave the office, and then you have your 20-minute commute, and you come home and you feel like you have to go right again. And I was like, when we're pregnant, it's more common to get up at least one time a night to use the bathroom, and that can interrupt our sleep. So the nervous system can play like such a big part in everything. And oftentimes it's the organs itself as well as the pelvic floor.
Working on breathing exercises, it has a lot of benefits, right? Because it can help regulate that nervous system. It can help exercise the diaphragm and also your pelvic floor.
Exactly, because it's all connected.
Pregnant or not pregnant, right? Like,
Exactly, yeah, and I love teaching breathing at the beginning so that people can tune into their pelvic floor, they have more of that awareness, and then we can, like, progress from there when we get that system to work really well. When you're moving your diaphragm, your pelvic floor has to move a little bit, like, you're using what your body already knows how to do, and then we can get some more voluntary control there.
when I did prenatal yoga, we worked on breathing the whole time. My teacher used to say so that it became muscle memory so that when you were delivering that you could return to that like more deep-rooted breath, and I never really thought about it. Now it makes
Makes
sense.
so much sense. And there's something to be said about that tension that can slow labor down. So like now as like a birth doula, I've seen so many labors that like if mom is stressed or tense or having difficulty coping, then the dilation and progress tends to slow down versus when
Agreed.
everything can be relaxed and they can breathe, it tends to go smoother. And
Mhm.
so, yeah, teaching those breathing strategies, but also those comfort measures strategies during pregnancy so that labor doesn't feel as overwhelming. Setting up your environment to be supportive, whether you're having an epidural or not, whether you're having a cesarean or not, like all those things are helpful to not feel so stressed, right? Like everything's gonna go better when we can relax.
The second time around, I was, like, nervous to create my own environment, but I had been in, like, to essential oils, so I just put them all over my body, but I would have loved to had the whole entire room just smell like that so that I was naturally just able to, breathe and use that as a tool. So I would say to women out there, like, who cares what anyone thinks? I was afraid that they were gonna, like, judge me on I mean, I do way way more crazier things now, not crazier, just, like, different types of things.
Yeah.
That,
Yes.
like, diffusing oils is really not that this is, like, your special experience in your space. You should do whatever it is, play whatever music you want, whatever smells you have, whatever it will take to calm that nervous system down because it does make such a difference.
Now hospital or at least the hospital I delivered at had essential oils on cotton balls, so women could smell them. That is one, I guess the diffusing can be so helpful. The other bad part is if that smell starts making you nauseous, then you, like, gotta get a fan in there, like, clear it out. So I was like, the cotton balls have been really helpful. So it's like, oh, they even offer that to me in the cesarean, right? Like, do you wanna smell like some lemon or lavender, like, to help calm your nervous system down? And then, like, if you start to feel nauseous, like, you can put it down, like, it's okay. I bring Northern Lights projector as a birth doula and set that up. I bring flameless candles so that we can keep the lights down. There's so many different strategies to, like, make that room your own. Hanging pictures on the wall. People will bring the ultrasound or pictures of their dogs, like, you can make it your space in, like, more than one way.
I think that's so important. Also to the
Yeah.
first time moms, like, do all those things because you don't know what to expect, and so the unknown can be so daunting and stressful, but so do things
Yes.
that make you feel the most comfortable while you're, exploring and going through that
Exactly.
experience.
Exactly. Wouldn't it be the world be a better place if we just felt, like, free to be ourselves? I feel like I look at my daughter, and she's only 14 months old, and she is just her, and she's just, like, without judgment, and I'm like, "Ugh, I feel like more of us need to, like, channel that, right?
For
If something
sure.
is important to you, like, share that with your provider. There's so many different ways that we can incorporate that, like,
Mhm.
that it doesn't have to
And if your
be.
provider is not on board,
Yeah.
then maybe find a different provider.
Exactly,
Yeah.
exactly. There's so many good strategies out there, and we don't have to be, like, ashamed about being ourselves.
Yeah, absolutely. Okay, so this kind of ties into what we were just talking about, and we mentioned it earlier, but just the ability to listen to your body. But I don't think that most women actually know what that means. I'll say when I was in this stage of my life, I would have been like, yeah, I'm listening to it. I'm not. I wasn't 100%. I was totally like, just go, 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 go. I feel that, whatever, it's fine, and just continue on. So,
What does that even mean, right?
any guidance?
Slowing down is, like, a wonderful thing. I'll often have people go through a body scan. So, like, laying down, getting into a comfortable position, and then talking them through bringing awareness, like, from the top of their head and working all the way down to our toes, and not labeling anything as, like, good or bad, but just bringing awareness, right? Like, are we holding tension in our jaw and our forehead? Are we holding tension in our shoulders? Or our feet, our jaw tension and actually foot tension can be a sign that our body is saying, "Hey, my pelvic floor is too tight right now." All those things can be, like, related or, in that body scan, we can kinda, like, see, am I taking a shallow breath? Like, am I really just going really fast and not really letting myself slow down. And it takes that pause, right? And so I did a
Mhm.
body scan before bed most nights, and that was very helpful on like, oh, I'm holding a lot of tension in my back right now, or I'm taking these really shallow breaths, and it's all connected, right? And so, like, if you start to notice those things, then you can bring more awareness to your pelvic floor as well.
Yeah, and I think the whole point in that, right, is just to recognize you don't need to solve, Just when we talk about listening to your body, it is just taking that moment to pause. You know, I used to commute on the train, so I had an hour. Had I done that, I could have just recognized. And then when I went to prenatal yoga, when I got home, I could have walked
Yes.
into that class and been way more aware instead of waiting
Yeah.
to that point towards the end of the
Yes.
class when maybe I was able to just
Yeah.
relax and recognize. So, yeah, I think it's just the exercise of pausing and scanning. I think that's something that everybody can really do. Yeah.
Yes. I was talking to someone this weekend and they're like, when I bend down to like when they were doing a deadlift, so they were doing exercise, they're like, my back doesn't feel great. And she's like, it took me months to realize that that was happening because she was like, I was just flying through my exercise so I could get them done before work. And she's like, I slowed down one day and she's like, oh, my back actually doesn't like this. And she thought she was doing something wrong. I was like, actually, there's some
Mhm.
just like modifications we can make. And there you go. So it's like I also just would encourage people to not label like I did something bad or like I did something wrong. Just let's bring awareness to it. And then also we can probably make some modifications. Or again, your body's probably trying to tell yourself something. And oh my gosh, I love my prenatal yoga classes. I was like, the yoga instructors probably would have some really great feedback if you had walked into that class to be like, hey, I feel like I'm just holding all my tension up here after
Yeah.
that work day. And be like, hey, you can do these things that might feel a little bit better, and then
Yeah, and you just have to advocate and speak up, right? And then you get that care. So I feel like as a society, and I don't know at what age this starts, women are really taught not to listen to their bodies. And our default at whatever point in our lives we've learned is just to continue to power through and push through. And so when working with women, say even during pregnancy and postpartum, I think the key here is pausing, preventative care, speaking to someone and just asking for help because all that can make a huge difference in your recovery. And something that I think was really beautiful that you said was if I work with a woman during pregnancy and I don't see her in postpartum, then I've done my job.
yeah. Yeah, exactly. Like, I would love to see people through the lifespan and, like, go through that journey, but so many times if I can empower people and give them all this education, then they don't often need me as much postpartum, or they just want to return to something, right? And we can build a program to do that. They're not having to fight this uphill battle of, like, leakage or constipation or, heaviness. They're like, "Oh, I just want to be more in tune with my body and like learn how to get to whatever that destination or goal is." And I can help them with that. I don't have to keep fixing their pelvic floor because they already know a lot of things about their body. So
Yeah.
much of it is like education. So much of it is that.
Can we talk about the pressures of the bounce back culture, which
Oh
I know you don't
gosh.
love?
No, I don't.
But how does it impact healing? Just the concept of bouncing back, which is another, like, inadvertent added pressure on young moms, right?
Exactly. And I think my biggest issue with the bounce back culture is the focus on aesthetics. Like you must look a certain way or be a certain way in order to have recovered. And so much of what strengthening and recovery is building a sense of community, right? Like when I have a mom's walking group. So it's like that exercise, walking, is as much for or, like, if someone has a gym that they love, right? That gym is as much for their mental health and building community and knowing they're not alone as it is for their physical health, and so I just don't like the idea that, like, exercise or fitness is only for aesthetics or, like, only to look a certain way when it should be about, like, community building and, like, feeling good and being able to lift up your toddler and not have pain in those early days postpartum. It's to be able to do life and enjoy life. I feel like bounce back is just it's just like another pressure, yeah, on, like, women, and you're like, "It doesn't have to be that way."
Just turn off the social media because that exacerbates it, right? Everybody knows, like, I can put up a great picture of myself and have had a really crappy day, and you just think I've had the best day of my life. Like, you can paint whatever pretty picture you want, even though you could be dealing with something complete opposite. So there's don't let anything that you see online feed or drive how you feel like you should be feeling.
You should be free to like feel what you're feeling. And then also, again, if it's bothersome, then like knowing you don't have to earn, it doesn't have to get to a certain point for you to be able to seek help. It's like both and we can hold both things at the same time. And I feel sometimes we have to like choose one or the other.
I loved too what you talked about, like each person's body is different. So each person's recovery is different. So what works for one doesn't work for another. So like my friend might be able to go and like run a mile right after she gives birth. And the thought of it, really scares me. So it's
Yeah.
because we had different pregnancies, different
Yes.
recoveries. We're at a different stage. She might have gotten 1 hour more sleep and I didn't, kind of have to give
Exactly.
yourself so much grace.
So much. Yes. And like my sister, for example, she's like, the thought of lifting weights, not my thing. Like that just like stresses me out. I feel worse afterwards. But she discovered Pilates and resistance bands. And she's like, oh, I feel really great. And I feel really strong. It's like, it doesn't have to be one form of exercise or strengthening for everyone. We can also adapt those things to be what's beneficial for that person in their timeline, the time that they have in the day, I mean, and then like what they enjoy, what they have access to. Are they going to be working out at home? Are they going to a gym? Are they going to be outside? Like,
That's great. You customize it to whatever it is that they need. Yeah, because I'm at a point now in my life, I don't really want any heavy sweating exercise, but I love being outside,
yeah,
you know?
exactly.
Yeah.
Yes. And I'm a firm believer in like that we can find strengthening within that because we know we start losing body mass in our 30s. And we
Mhm.
know that that muscle mass is linked to our bone health and we want good bone health and we want to age well, but that can look different for everyone. And the important thing is that you're finding things that help you get strong, that you enjoy and help your nervous system. And a good clinician should be able to adapt that and give you confidence in whatever that is.
So we mentioned a little bit earlier, like access to pelvic floor specialists. And so to check at a state level, if you need referrals. But what are you seeing when it comes to access to postpartum care, specifically pelvic floor care in, say, like a traditional hospital system? Because you came from there, right? So I think you can offer a really interesting perspective.
I enjoyed my time like there. I just noticed there's a long wait list, wait time. So I would see people maybe in their second trimester, but then I want to be able to see them till their third trimester just based off of like timing within the
Like
schedule.
workload, caseloads and
Or
stuff.
yeah,
Yeah.
caseload wise or like equally postpartum, it would have been so much more beneficial to so many patients if I could see them 6 weeks postpartum or 2 weeks postpartum to help them with their pain levels, but I'm not able to see them till 12 weeks, and now their maternity leave is over, and now they have to balance their 9 to 5 and make room for an appointment. And so that
That's
access,
huge, actually.
yeah, and that makes a big difference. And so one of my goals when starting my own practice was to increase that accessibility and making sure that I could fit people in a reasonable time. So what we're noticing in the hospital system is those longer wait times. And then also clinicians are having to be like, okay, well, only the most important, like only the most severe cases need to get in here because of that. And so like then people are end up waiting until things are like really bad and then they go versus we can do things in a preventative
Mm.
manner in this private practice like model.
And so you
Yeah.
would be like at a network.
Yes, I am out of network. I'm a private practice. I do provide a super bill, so oftentimes insurance has out of network coverage and you can submit a super bill for that.
I was gonna ask if there's insurance limitations. So, like, do I have to be on a scale of 1 to 10, like an 8 in order to get insurance to cover it? Or if I'm having really bad lower back pain, can I get it covered?
When you go in network, you're dictated by like what insurance will cover. And so different insurance plans will not cover certain things. So that was another frustration I had is that I might bill someone for they have pelvic pain, right? Like so they have pain in their pelvis, and then insurance might be like, we don't actually cover that code. But if you bill it as low back pain, we'll cover that. And you're like, oh,
Mm.
okay, but they have pelvic pain. That is what they have. And so I appreciate that in this model, I can treat people for what they have
In the time frame that they need it,
in the
right?
time frame that they need it. Yeah. That makes a big difference.
It does, if there's a long wait
Yeah.
line. And if it's like, I would have been hesitant to try, and then if I tried and I went and they were like, "Oh, well, we can't see you for 7 weeks." And I'm like, "Well, in 4 weeks, I'm going back to work." I would just walk away. And then here I am with these symptoms, and then that's just like one other thing. It's so true. Yeah.
It's so and then time is another one, so I offer hour-long treatments. Many times hospital systems, have to do, like, 45-minute treatments, just because they take insurance. There's a other misconception that, like, if we use insurance, it's cheaper, but someone wanted to use their insurance, so they called one of the hospital systems and was like, "Okay, like, with my insurance, what would this cost?" And they were quoted, I think, somewhere between, like, $350 and $400 a session using their insurance.
Hmm.
And then my sessions are 175. Like
Don't assume that out of network is cheaper. You do your research. Hmm.
exactly. Yes.
Yeah, that's
Yeah.
actually really, really important because I feel like a lot of the practitioners that I have on my podcast, not that yours is alternative, I just feel like it's not as mainstream as it should be. More, I
Yeah.
feel like every woman should be going to a pelvic floor specialist. I still haven't gone to one. I probably should.
Yeah. Come see me. It'll be great.
I know there's tons of women that I've spoken to personally that need to see you, that are like mid-40s with issues that I'm like, "You don't need to live like that," right? And it's because they were never addressed. So, I'm gonna bring it
No.
back to the listener. For anyone who's listening, whether they're pregnant, postpartum, or years out, many, many years out, like for me, for example, where should they start?
That's such a loaded question, isn't it? If they are having pelvic floor symptoms, I think calling their local pelvic floor physical therapist, I should say, is a great place to start. So if they are local to Charlotte, I am part of the Greater Charlotte Pelvic Collaboration, where we are all individuals who own our own pelvic floor therapy business. We are either mobile, which I do offer mobile services. We have in clinic throughout the greater Charlotte region. So we have north, south, east, west providers. And I think that's a great place, like calling them up and finding the clinician that you mesh best with because it is a vulnerable process. And I think it's equivalent to like, finding an OB that you trust. It's a vulnerable thing. And so you want to go in with a clinician that you are feeling most comfortable with. I'm pretty sure most of us like have free consultations. So like talked with us. We can, tell us your story. We
Mhm.
can give you some feedback and make a plan from there.
And also, by the way, listeners, when you go and get work done at your house, there's always a rule of 3. Like, you should get 3 quotes if someone's gonna redo your bathroom. So talk to 3 pelvic floor specialists to see who you connect with, because 'cause you're right, it is such a personal and intimate therapy, and you should be comfortable, right, with the person that you're working with. So I'm gonna take that, like, contractor rule of 3 and apply it here.
Yes, as you should. I was like, it's
Yeah.
so important. And yeah, it should be more accessible. And everyone needs something different. And I was like, it'd just be really great if everyone got the care they needed and didn't wait, or even if they did wait, know that it's not too late. That would be very, very empowering, I think.
So, can you share with people how they can access you? I know you said it briefly, but just say your company name again, how to reach out to you.
Yeah, so I am Tranquility Pelvic Health. I am a mobile, virtual, and now in clinic physical therapy office. So I am now located in Hugate, Belmont. So that is a co working space near Plaza Midwood, Belmont of Charlotte. And I will also come to your house if you need it, as well as offering virtual visits as long as you're located in the state of North Carolina. I'm also on Instagram, which I'm trying to get better at posting about. And my handle is at Tranquility Pelvic Health. I should also mention I do a mom walking support group, which I mentioned briefly throughout the podcast. And so that is the first Sunday of every month at Freedom Park, and it's called Mom's Move. And you can find the link to sign up on my Instagram.
I love that. Community is so important. Your village is so important.
Yes,
So,
it's huge.
even though that seems small, ladies,
Yes.
whoever's listening in the Charlotte area, do it. Go out there because you don't know what kind of connections you will make. And there's all women out there who are going through the same exact things. So, that's the great thing you're putting together for women.
Thank you. I appreciate
Yeah.
that.
Yeah. So, any lasting piece of advice
Oh
for our listeners?
gosh. Yes, I was trying to think about this earlier, and I think something that I had said earlier, which is like when you're staying active or you are finding something that you enjoy that helps your body move and move well, that is as much for your mental health and community building as it is for your physical health. Finding that thing is just, it's so helpful. I went on a hike for the first time a few months ago and I was like, oh my gosh, I miss this. I want people to know that it doesn't have to look one way and that we can find something that you love to do. So, one more piece of feedback or token of information that I found really valuable is that we're up to, I think, 54% of women will say that they have a pelvic floor dysfunction, and that can mean a lot of things. And that I think half of those women said that that is their barrier to exercise. It's so important to address, and then also you're not alone. So many
Yeah,
of us are
half of the
going.
people in America. Think about that. You go out to dinner with 6 people, half of you have some form of pelvic floor dysfunction. So it was common,
Exactly. It's so
but not
common.
normal.
Exactly. And not normal.
Okay. That just lays it out there for everybody. You are not alone.
No. And
Get
something that
help.
can be corrected. Exactly.
Yeah, for sure.
Yeah.
Well, thank you so much. So I'm just going to go through and just kind of take away a lot of what we talked about today. Just because something is common doesn't mean it is something you have to live with. That's so important to all the people who are listening right now. Your body is not working against you, it's communicating. And the more we shift from a reactive approach to more preventative, supportive one, and maybe reflective, do those body scans, the more we can change the entire experience of pregnancy and postpartum. So thank you for being here, for listening, and for being part of Women's Wellness Authority. If this episode resonated, share it with another woman who needs to hear it, because this information is information we should have had all along. So if you found today's conversation valuable, follow the show and leave a review. It helps more women find this space. And until next time, stay curious, stay empowered, and most of all, stay well. Thanks, everyone. Thank you for tuning in to this episode of Women's Wellness Authority. If today's conversation inspired you, shifted your perspective, or sparked something within you, I'd be so grateful if you'd subscribe, leave a review, or share this episode with someone who might need it the most. Have a story of your own or something you'd like to share? I'd love to hear from you. You can connect with me on YouTube, Instagram, and Facebook at Women's Wellness Authority. Please note the content shared on this podcast is for informational purposes only and is not a substitute for medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider regarding your health and wellness decisions. Until next time, stay curious, stay empowered, and most of all, stay well. Thanks, everyone.